Doctors are warning parents about animal bites in their children after a Louisiana toddler was recently bitten by a raccoon. We take a closer look on this week's edition of Today's Health. Brittany Glaser has the story.
It was a recent medical chart that caught pediatrician Lyle Stevenson's attention at the Pediatric Center.
We recently had a child that was bit by a raccoon in her backyard and had to go to a local hospital and received the immune globulin and the rabies vaccines.
That little girl is doing well today, but it's a reminder about the health threats of wild animals and unvaccinated pets. Dr. Stevenson says dogs account for 80% of treated animal bites.
Most of the time it is the family dog. In younger children tend to get bit in the face because they put their face in dogs' faces. Older adults and older children tend to get bit on the extremities, the arms, the legs, and things like that.
Cats follow, but the wound is typically different than a dog's.
A dog's going to kind of clamp and crush, whereas a cat's just going to kind of puncture you and then go away.
If the animal is up to date on a rabies vaccine, the concern for the person bit is inflammation and infection at the site.
These animals can have the same organisms growing in their mouth that you and I do and on our skin, so we worry about things like staph and strep, which can cause localized skin infections. We also worry about a particular organism that grows in their mouth called Pasteurella.
Pasteurella can cause an inflammatory infection at the site of the bite. Dr. Stevenson says if the animal is known to be vaccinated and the bite is minor, you can treat it by washing it, then applying antibiotic ointment. If it's deeper or you don't know the animal's health status, you need to get to a doctor immediately.
Usually it's just flushing it out, and every now and then they'll put some antiseptic on it or something like that. In some cases, stitches are required. Some cases, more surgery is required with severe bites or with crush injuries from bigger dogs especially.
The bottom line, avoid wild animals and unfamiliar pets. If you have family pets, teach your children safe techniques to pet or play with them.
The most common signs of rabies in an animal is foaming at the mouth. In other health news this morning, just one glass of wine a day may increase a woman's risk of breast cancer. That's according to data from over 100 studies of 12 million women. Drinking 10 grams of alcohol a day increased breast cancer risk by 5% in younger women and 9% in postmenopausal women. But exercise appears to lower the risk of breast cancer. The most active women were 10 to 17% less likely to be diagnosed with the disease. A new Ohio State study suggests there is no health benefit to so-called light cigarettes. Data shows the most common type of lung cancer actually increased after ventilation holes were added to light cigarettes 20 years ago. Researchers say this allows smokers to inhale more cancer-causing toxins. They're urging the FDA to regulate or even ban the use of these ventilation holes. A new survey reveals firearms are kept in 18 to 64% of homes in the U.S. Almost 40% of parents wrongly believe their children don't know where these weapons are stored. Researchers say there was also a mismatch in the number of parents who said their child would never touch a gun to the number of children who said they have handled firearms, even pulling the trigger. Firearm-related injuries are the leading cause of injury deaths among youth, according to the Centers for Disease Control. That's it for this week's edition of Today's Health. And coming up on KPVI News Today, we take a look at your KPVI News Today headlines.